Hi, I'm Jerry Bailey. I'm the COO at Business Technology Architects. I'm here at Ballad Health in Johnson City, Tennessee with my colleague Mike Larea and our mutual customers Pam Austin and McCoy Davidson. Pam and McCoy, thanks for joining us this afternoon. Can you start by telling us a little bit about your roles and responsibilities and maybe a little bit about Ballad's mission here?
Thank you, Jerry, for the opportunity. I'm Pam Austin, Chief Information Officer and Senior Vice President for Ballad Health. And my role is to help the organization understand where technology can help move the mission forward and collaborating with my peers on the strategic plan for Ballad Health. And our vision is to be the leader in the industry from a technology standpoint and helping Ballad meet its mission.
Awesome, McCoy.
And my name is McCoy Davidson, and my role is Senior Director of Enterprise Technology and IT Solutions. And I'm responsible of a team of people who work on architecting solutions and planning future strategies for technology for the entire organization.
So tell us a little bit about Ballad.
Sure. Ballad Health is an integrated healthcare delivery system that covers around 29 counties in Northeast Tennessee, Southwest Virginia, Northwestern North Carolina, and Southeastern Kentucky. We have a family of 22 hospitals that are in Northeast Tennessee and Southwest Virginia. And Ballad Health came into existence February 1st of 2018 as a result of a merger of two healthcare systems in our region, Mountain States Health Alliance and Wellmont Health Systems. And the reason we became Ballad and those systems came together is to take care of the pressing health issues in our region. And our mission statement is to honor those we serve by delivering the best possible care. And our tagline is, "It's your story, we're listening." And we certainly have a story to tell about this merger and acquisition and the technology that is the foundation for the organization.
So wow, you had a significant challenge on your hands to put the technology platforms for these two organizations together. Tell us a little bit about your business objectives as you were going through this and how you approached this challenge.
So we set out, soon as we became Ballad Health, was to get on a common electronic health record. That was the first priority because we were running two disparate systems and we needed to join that together. And as part of that, then we realized the underlying infrastructure needed to come together in order to get the electronic health record live in a timely manner. So we set out to, and McCoy designed what that's going to look like, and we set out to engage with our business partners to come together with a solution that would allow us to meet the goals and objectives of the timeline for that technology.
One of the things that we really had to look at was both organizations had aging infrastructures that needed to be not only consolidated but updated and refreshed just about across the board. Everything from the EMR to the workstations to the data centers and the networking infrastructure in those data centers. So as an objective, we needed to make sure that we updated and built an environment for the hospitals that not only satisfied the immediate business need to do the merger itself, but also build a foundational layer that allowed us to be prepared for the future and anything that would come at us going forward that the technology needs or organizational strategies, and we would have enough flexibility to be able to deliver what was required.
Well, that was really great. Can you tell us a little bit about why Cisco and BTA specifically?
So Cisco has been a long-term business partner of ours, and they've earned our trust. They recommended BTA to us. They were unknown. We'd never used them before. They earned our trust, and they absolutely delivered on time and under budget. And they have a simple process that you use, and they're a great business partner for us, and that's why we selected BTA on the recommendation of Cisco.
Great. Anything to add to that, McCoy?
Oh, absolutely. One of the important things that we realized as we engaged with BTA from a partner perspective was the investment that they had in what we were trying to achieve and meeting our goals. And they took a great amount of effort and time to understand what we were doing, who we were, and what our needs were, and ensured that as we mapped out and made a plan, we were able to deliver that effectively and efficiently and meet our timelines. And changing over from a legacy network infrastructure that we had into an ACI environment with software-defined capabilities and all of the automation and benefits that come with it, it's a huge paradigm shift for any organization, any networking team. It's a significant change. And so they instilled a confidence in what they could do with us and how to deliver it, and a methodology that made sense, and we believed it could be delivered, and absolutely it delivered on time and on budget. And with the amount of, we talked a little bit earlier about the complexity of the things we had to do to make our organizations merge and deliver the EMR. With those types of things in play, the network is the foundational layer, and if we couldn't deliver what we needed to from a networking infrastructure perspective, every other project, every other component would be delayed, or we wouldn't be able to deliver at all. And we knew as we met with them and worked with them, and they had such a tight partnership with Cisco, and we had the collaborative conversations and meetings, we would be successful with that group and the project we were delivering, and we absolutely were.
That's great. And I'm sure you've learned lots of lessons, but can you share one key thing that sticks out in your mind?
Usually with lessons learned, you think of something negative, but I will say this from a positive standpoint. It's absolutely critical that you use a business partner that is tried, true, and dedicated, and brings forward the expertise in the field. And that's what BTA did for us. We were extremely impressed with the work they did, how they did it, and their delivery, and we'll absolutely use them going forward in the future.
That's great. McCoy, for you?
One of the big things is just making sure that when, it's easy to pick a technology and say, we're going to go forward with this technology, this is our strategy. It's a different thing to have all of the team members, an entire IT organization get behind that and rally behind it and support it and want to go forward with it. And once again, with such a significant change from a legacy networking infrastructure to an ACI infrastructure, it was critical that we got the entire networking team and anyone involved behind, on board, understood what we were doing, what we were trying to accomplish, and really, pro a new paradigm. And once everyone was behind it and on board, we were able to really get a lot of energy and focus and successfully deliver this project. I can't overestimate or overstate the importance of making sure all of your team players are on board and believers in what you're trying to accomplish. And when we had that, and BTA was able to work with the teams directly and talk through and allay their concerns and discuss how it was going to impact their future job roles and the way they would do their jobs, our teams were believers, and it shows today.
That's great to hear. Gary?
We appreciate that. I think there was a lot of good leadership on the Ballad side to make this happen. Everybody really bought into the project. So now that we have the next generation data center constructed, and we've built our own private cloud, and we have software that we can manage these data centers. What about the future here, both from a business perspective and from a technology perspective?
Ballad Health has a great and bright future ahead, and technology is going to drive that forward. Our goal is to make access for patients to Ballad Health easy through digital technology, through any type of technology that's going to allow the patient to have easy access to care. We have a lot of rural hospitals and rural clinics in our organization, and we want to make virtual health, digital, available to those patients so they can get care quickly. Ballad has a great future ahead, and we're looking forward to partnering further with BTA and Cisco to make that happen.
With hundreds of locations scattered across a large geographical area that we support, the rural nature of our entire infrastructure, we always have to focus on doing more with less, and that's not going to change anytime in the future. So more automation, more capabilities to be able to do less effort and deliver more services, that type of mentality and operational process is what we're going to have to put into place. And the ACI infrastructure really gives us the foundation to be able to do that. And then on top of that, focusing on the additional security aspects capabilities that it brings to us, microsegmentation, those types of things that we can do to limit traffic to where it needs to go. Those are the biggest things that we're going to be focusing on in the near future.
That's really great. Well, thanks again for sharing your story today. We're really excited to be a part of the journey and continue that with you. We can't wait to share this with our Cisco colleagues and everybody in the sales organization. So thanks again to all of you. Appreciate it.
Thank you for the opportunity.
Thank you.